Good morning, everyone. Can everyone hear me?
Yes.
Yes, we can hear you, Anthony.
Right. Stuart, are you on?
I am, yes, I'm here in the training room, if you can hear me.
Yes. Are we ready to get started?
Yes.
Okay. All right. I'll call to order our October 10th Georgia Board of Community Health Care Management Committee. Welcome everyone to our meeting this morning. We'll kind of start by assuming everyone had a chance to review the minutes from our last meeting, which was April 11th. And then Stuart, would you like to, our next item on the agenda is a review of past presentations. Would you like to kick us off with that, please?
Certainly. Sorry, someone have something else to add? So our last presentation was back in April, and we had a conversation on, and that is because in July we were due to a variety of scheduling challenges and presentations that were relevant to today. We were not able to meet, and I can explain that, Chair Williams, for just to share that we went through a process of certification with CMS as it related to the EASE program that Daphne will be speaking about. Daphne, the Executive Director of the Office of Analytics and Program Improvement. And so it is a better time today than it was in July to have that conversation so that we can actually hear more about how this is going to play a role and make a broader difference. So that is why we did not meet in July, but we are very excited to have the presentation today.
Okay. All right. So with that said, then are we ready to move to that presentation? So our kind of, I think our big topic this morning is the EASE presentation. We all got a little bit of a glimpse of the information that was sent out, focusing on our analytics. So with that, can we turn it over to Daphne?
Good morning, everyone. Are you able to hear me?
Yes.
Right. And I'm going to share my screen. Please confirm you're able to see. Are you seeing my screen?
Not yet.
Not yet.
Let me try it again. How about that?
Yeah.
Yes. That we can
Okay,
see.
awesome. Well, thank you, committee and Stuart, thank you for giving me the opportunity to talk about EASE. It is a pretty exciting time for us, not only as an office, but as a department. And so again, my name is Daphne Kitt. I'm the Executive Director of our Office of Analytics and Program Improvement. And today we'll be talking about our newest data warehouse, the Enterprise Analytics Solution for Everyone, or EASE. This is just a slide of all of our faces. We're a pretty small team, small and mighty is what we call ourselves, but I specifically wanted to list out just so everyone had an understanding of what OP is comprised of at this time. So we have a decision support services team. They are specifically responsible for reporting and analytics for the department across our Medicaid and state health benefit plan populations. We have several standard requests that we provide to the department, and we also respond to internal and external data requests, again, across the organization, as well as from stakeholders. I'll skip over EASE for a minute. We have a data management team that are really supporting our data governance efforts. We're trying to increase our maturity in data governance, and the solution is one of the ways in which we're doing that. We have a continuous program improvement team, and some of you may have worked with them. They are specifically working on reducing administrative burdens for our members as well as our providers. And so they work a lot with the CMOs directly, as well as advocates in the community for the Medicaid population, and identify things that would make just the lives better for, again, for members and providers, whether it be looking at non-emergency medical transportation and the usage of those services, or, streamlining the prior authorization process, which is something they did last year. So a lot of, great work coming out of the CPI team. And then business operations, this is kind of our administrative area for our office to keep us on track from a project management standpoint. All of our recruitment, hiring, strategic guidance comes out of that team. And then lastly, we have ease. The department has had a data warehouse in some shape or form for well over 20 years. Most of that time, it was a proprietary solution with IBM. And we decided a few years ago that we could do something a little bit better that provided the organization with more control, and that is how ease came about. So from a strategic vision standpoint for our office, what we're looking to ultimately be is a business intelligence leader for healthcare by promoting the adoption of data services and increasing data quality and supporting any sort of data management efforts, again, that push the department in a place where we're able to use data more strategically and to use data for our decision making. We have some goals as a team just over these last few years, enhancing our data services, which again is strongly tied to the ease solution, implementing data governance, implementing the data warehouse, and then again, relieving burdens for stakeholders for the member and provider communities they serve. Tactically, we look at it. I see a hand raised. Or maybe not. Okay. Tactically, the 4 things that we're really focused on is making certain that anyone that we serve, whether it be through data, whether it be through our continuous program improvement efforts, that we're able to increase stakeholder satisfaction, data availability, making certain that people have access to the data we need, wanting to increase the number of dashboards and reports that we have available publicly, and also increasing the availability of data that can be used across the enterprise. Right now, we're pretty siloed in terms of data, and the data warehouse is something that we're expecting to use to break down those silos and really identify where data from one area might be beneficial to data in another area. Data transparency and trust. Obviously, if you don't have trust, if people don't trust the data, it's difficult to be successful. And so we're really honing in on making certain that we have reconciliations, making certain that as we put data out, it's consistent with what we've done historically. And we're also wanting to make certain that as users of data, we make certain that people understand it, just have the intelligence about how data works, so that when we're talking about different metrics and measures, everyone's on the same page and they understand it the same way. And then stakeholder awareness and participation. As I mentioned, we're wanting to increase data governance maturity across the organization, and that requires participation across the enterprise, not just within our team, and really not just for people who look at data every day or you may use data every day. The business and the policy side is just as important, actually more important than the technology. They are the ones that are driving the technology to be able to get the data that is needed. This is an old model, about 10 years old from Gartner, but it really lays out and you know, from my perspective, what we're wanting to do within the organization. Right now, we are pretty much in the descriptive and diagnostic kind of analytics place. We, you know, tell you what happened, maybe why it happened. But we're really wanting to kind of move up that escalator and get into predictive and prescriptive analytics. And so, you know, before we even, you know, approach kind of the methodology and the manner in which we would move forward with our data warehouse, this was something that we had in mind, like what will be something that allows us to mature from an analytics standpoint. So that drives us to our purpose of the e-solution: design and implement an enterprise analytics solution to drive better decisions and actions across all units of DCH and beyond through a modern data warehouse with powerful and productive tools, effective data management, security, and agility with timely, trusted, and integrated data. This purpose is specifically addressing a lot of the pain points that we had for so many years with our legacy solution. Number one, being able to make certain that we created something that could be used across the entire department, across Medicaid, SHBP, we have CON, HFRD. We're wanting to bring that data together again to break down silos. And also understanding that technology has changed a lot, not only in the last 20 years, but really in the last 5 years. We originally were looking at doing something on-prem. This was about 10 years ago. And then we, as a state, you know, through our Georgia Technology Authority, realized that, you know, cloud was an option for us. And so the e-solution is in the cloud, and we were able to identify through our pilot software as a service and other software from a data warehouse automation standpoint that were powerful enough, productive enough, and gave us full ownership of the solution. So our vision: right analytic data at the right time, right people, right reason, right way. This is all about being able to connect with the business. And so this is something that we're hoping, again, to continue to push and provide maturity in as we work more with Stuart and his team, everyone in MAP. But again, also with others across the organization that may have data that will help support the Medicaid program, become better performers in our metrics, especially around maternal mortality, behavioral health. So we know that this is a big focus. We want to make certain that as the department and Medicaid specifically defines those metrics that are important to them, that we have the data to support those metrics, and we're able to provide it in a timely fashion and in a way that represents our populations best, so that we can make those good decisions. And so for ease, just as an overview of what we can do within this solution, Scalability is on demand, and basically what that means is within our actual data warehouse, which is a service called Snowflake, we're able to scale it up and scale it down. And so if you think about an actual an actual warehouse, like an Amazon warehouse, in one city may be very small. And so they only need, 1,000 square feet for their warehouse. But then in Atlanta, maybe they need, a 50,000 square foot space. And so we have that flexibility within our data warehouse. If we're working with something small, we can keep the warehouse small, but then if we need to bring on a lot more data or run more complicated analytics and queries, we can increase that size, make it larger. That makes it run faster and allows some of that complexity to be done quicker. We are looking for this to be our single source, and actually we have single source of truth, but we've actually kind of changed that methodology to single version of fact, which basically means that whatever is true for DCH, that is what we want EASE to represent. EASE is not the source of the data. We'll be pulling in data from the CMOs and from, our provider module and all of our other modules across the Medicaid enterprise. And so when that data is integrated and comes together from a reporting and analytics standpoint, we're looking for it to be what DCH considers the fact. This is what everyone understands this data to be. More timely data, we used to work on a 60+ day delay in information. We now have data, we're receiving it more frequently, and we're able to ingest and update more quickly. And so we can provide data through September on October 10th. That was not at all something we were able to do for many, many years. If we wanted September data, we'd be talking about, December being able to provide that information. So having that more frequently, obviously, provides help in making decisions. I won't spend a lot of time here. This is like a lot going on, a lot of lines. But what this really represents, and this is something that was helpful for us as we talked to CMS about what this warehouse would be, is to have our strategic outcomes laid out. And so everything that's in a circle is a strategic outcome. The squares are things that like activities that we knew we had to do. But again, this really demonstrates that we have a big focus on making certain that we can get access to data quicker, making certain that we have good security around the data, especially because we plan on bringing in data from multiple sources. Our data latency reduced, I just kind of spoke about that, being able to provide up-to-date data. The quality of our data, improving the quality of our data. We know that there are several things about the data that we receive now that could be improved. Demographic data is so important for us, especially when you're thinking about social determinants of health. And we really do have, especially for like race data, is not the greatest quality. And so if we're going to move forward and be able to implement policies based on information about all of these other external factors that play into a person's healthcare experience, we need to be able to have that data so that we can address those problems, as effectively as possible. Richness of data, again, being able to add to the data within the Snowflake environment. We have the ability to kind of shop for data sources And so we can go and search out, any data, say from CMS about providers that they have available on the web. This service that we use called SparkSoft, they go out, they find the data, and then they push it back into our Snowflake environment. So we have it's just so many opportunities that we have with this solution. As a requirement from CMS, we have to have certain outcomes documented. And so just listing here and showing some of the, or not some, all of the outcomes that we are tracking for CMS purposes. And again, kind of talked about these already, time and effort, reducing the time and effort to get data sources in, a more agile solution, meeting the needs of the department, increasing collaboration, building business intelligence. And one big thing is, reducing cost. This solution is less expensive than our proprietary solution. And that savings, helps to pour back into the department, whether it be through getting, better and more skilled resources, or adding in, more data that would be helpful for the department. And so that was a big win for us, especially on the financial side. So as an overview, from a timeline perspective, I mentioned that we, did a pilot just to make certain that the software we are using and the architecture we expected was good. And we did that in November of 2021 through January of 2022. And then from there, we just continued to work until we made it up to the end of our IBM contract, our legacy data warehouse solution, which was June 30 of this year. And then in July, we went for certification with CMS. And so that was a successful meeting. We're now awaiting our formal letter and notice to indicate that we are fully certified by CMS as the department's data warehouse and decision support system. We were or have or are an agile project. And so that's what kind of that continuous, those loops represent. This is a solution that we will continue to enhance. And so there really isn't a finite end to what we will do as, again, new data sources are identified. We'll work to pull those in. As new standards come out, we'll work to pull those in as well. Hand up, is that for you, Stuart?
It is. Thank you, Daphne. I want to, for the committee, just share the finer point, because while you've outlined this very important process, I think it's good for everyone to know that the leadership of the actual data group within the Centers for Medicaid and CHIP Services at CMS was here in person. The review was in person. It was a very deep dive, as deep as you can go into the technical operations and what this means and how do you achieve those outcomes, to the point that CMS operationally has been bragging about the capabilities of Georgia going forward after they get, before it was on paper and they were excited. After spending a full day here with Daphne and her team and Chad and others within DCH, the excitement level is very high, and they can't stop talking about the ways that this will improve outcomes and how they want to see it succeed so they can start to talk to other states to start to do what Georgia is doing. So just to put a finer point on it, I think it's an important one.
Thank you, Stuart. You saved me from having to dote on the team myself, so I appreciate it. Here's a contextual diagram, again, just to give you an overview of what we are thinking this warehouse or want this warehouse to be. It's a pretty, basic slide, but as you can see, we've got all of our areas across the DCH enterprise we're expecting all of that data to go into ease. We have our, interagency data, all of our sister agencies, we have relationships with them. We, in the past, have been sharing data, extracting a file, putting it on an FTP, and, they pull it up and they match it and send it back. With the ease solution, we have the availability or the ability to expose data directly in the data warehouse in Snowflake. And they can go and get it. The best thing about that is that data doesn't leave. So from a security standpoint, we have it's just more secure from the standpoint that we aren't just sending data out to all of these different places and really not having any control of it once it leaves our environment. So again, a lot of great things that come from the use of Snowflake and that really support our ability to take in all of the data that will be related to our Medicaid Enterprise Strategic Transformation, as well as information from other areas within our department that can help support both the Medicaid and state health benefit plans in making better policy decisions. Getting close to the end, this is just showing the data that we currently have. We were wanting to make certain at the end of June that we, within ease, had everything that was within our IBM legacy solution. And so everything that is in blue is what was originally in the IBM legacy solution that we have now. And then the lighter and darker green areas are new data sets that we've added into ease, or data sets that we enhanced. And so this right here is, it's a very simple slide, but for us, when we look at this, it's already a win from our, legacy solution. We already have more data than we used to have access to. And so we want to continue to expand and expound on that. We're collecting data from several areas that we haven't fully ingested into the ease solution. Again, that's part of the agile enhancing over time, but just wanted to point this out because it's information that we, very quickly, information that we did not have access to that we do now. So that is all I have for you today. I'm more than happy to answer any questions you may have. It's been a pleasure being able to present on ease. Always enjoy the opportunity to talk about what we're, wanting to do within the department with our stakeholders. So I will end there and pass it back to you, Stuart.
Thank you. And Mr. Chairman, we can open up for if there are any questions for Daphne, but I will also note that the point of this was to make sure everyone had a sense of what is newly developed and what the offerings could be. But then in 9-12 months or so, if you're interested, if the members of the committee are interested, we can have more of a use case specific follow-up on sort of policy areas of interest. We'll have the formal certification letter. And if there are areas where you're curious about how does having this better use of data actually translate into policy decision-making, we can have a little more of that kind of conversation now that we've sort of set the stage here.
Thank you, Stuart, and thank you, Daphne. It's a very impressive system, and clearly one that's been in the making here for, as you said, 28 months, and a major project. I do have a clarifying question, and then would like to open it up for others. So is this system live now? You mentioned the IBM legacy system as well. Have we shifted over to this system and we're using it today as our source for our data needs?
Yes, it is live. We when the contract ended for IBM June 30, we did no sorts of renewal, so we allowed that contract to expire. And we have been using ease since that time to respond to queries and needs across the organization.
Okay, because you mentioned the CMS certification is still, I guess, pending. Is that right?
So yes, we did the actual certification meeting at the end of July. And then we were instructed to move forward with requesting the increased federal financial participation, which is only provided to systems that get certified. And so we completed that documentation that went to CMS last week. And so we're waiting for that final notification still. What we've been told is that the letter has been drafted and it is, a part of a stack of letters that have to be signed by, the higher ups within CMS before submitted.
Other questions from our board members this morning for Daphne or Stuart?
I do have a question for Ms. Daphne, Cynthia Rucker. I definitely appreciate learning more about this program. Does it utilize Power BI to extract? Is that?
Yes, I'm glad you mentioned that because I didn't have a slide that really talked about the full architecture. I thought it might bore you, but I'm glad you asked. So Snowflake is agnostic when it comes to business intelligence tools. And so the department has adopted both Power BI and Tableau as tools to use. And again, it's just as you just connect it to the warehouse. It is, again, something that provides us with a lot of flexibility. If for some reason, Tableau or Power BI are tools that we no longer want to use and there's something else that comes out, we just connect it to the same warehouse. And so we get a lot of flexibility from that.
Okay, thank you.
Mm-hmm.
Other questions from our board members this morning?
No question, Anthony. This is Roger Folsom, but certainly an excellent presentation and very useful data for all of us, I think.
Yeah, I agree. I agree. This is Shane. I agree with you, Roger. It was just very, very professional and excellent. And Daphne, y'all did a great job over there. And it's nice to know that we have such competent people. But I thought it's one of the best ones I've seen in a long time, honestly. It was very concise. I liked it a lot.
Thank you.
It's very impressive. I mean, it certainly appears to be a rather state-of-the-art assembly in terms of the way this has all come together. So congratulations to you and your team. Is the system meant to, in terms of extracting data, we've seen reports in the past and the dashboards and those sort of things for our team members within DCH. Is this system meant for them to be able to access the system and be able to pull the data they need out on their own, or do they still need to put in information requests and work with folks who maybe have a little more IT capability and training than they might have?
Yep. That's a great question. And actually one of the outcomes, I didn't touch on it, one of our outcomes was, increasing business intelligence across the enterprise as well as self-service. And so the goal is within the Tableau and Power BI interfaces that provides the opportunity for people to either do click and drag reports or just get access to dashboards that they may have asked us to create. An example of that is while we were in implementation, our program integrity team, they had data they were receiving from the CMOs, and it helped keep track of their open cases. And they gave that data to us. We created a dashboard for them, and now they're able to log in and see their dashboard. And so every time they provide us the data to update it, the data goes in, the dashboard is updated, and it's there available to them. So it's two pronged from the standpoint that there are some people that they're not power users, but they're business users, and we provide the opportunity for them to go in and use the solution, and again, click and drag and drop on reports. And then we also have more of a viewer user where they really don't have any interest in creating their own reports, but they do have data that they want to look at on a regular basis through dashboards and other reports. And so they get access to that just to be able to view their interactive, as the Tableau or Power BI dashboard would be. And then we have our power users, and those are the folks that may use Tableau and Power BI, but they are more specifically working within the Snowflake environment, using SQL and Python, again, to do more of the complex queries. Ultimately, we want OB to be the group that does the more heavy research-based analytics, as opposed to, the day-to-day operational things that business users can pull for themselves, so that we have then a dedicated team that's doing more mining of the data, finding things to bring out to the policy and program leaders. So that's what the goal is. We're still working on it, but we know we'll get there.
And one final question from me. Does the CMS certification process, does that require like an ongoing kind of monitoring or annual visits or demonstration of compliance? How does that kind of go into the future?
Yep. So there are the two things that CMS requires of us. So every year we'll have to do an annual planning document. And that will kind of talk about what we've done over the last year and tell them how we've used, the federal funding for the solution. And then on a quarterly basis, we will be providing them our outcomes and metrics. So that kind of results chain that you saw with all the squares and the circles, all of those circles require our outcomes, and we have been collecting those since January of this year. And so we had to, for certification, we had to have collected 6 months worth of outcomes to even apply for certification. So we've been keeping up with all of those outcomes. CMS's expectation is that we track those outcomes quarterly, and we identify, are we improving in areas? Are we, not doing as well in certain areas, and what we need to do to change that. It may be that we're measuring the wrong thing. So the new certification model with CMS is really focused on outcomes. And I think what they really want us to do is to identify what success looks like for us, and make certain that that we have metrics that support that, what that success looks like, and are looking at it, measuring it, and making changes when necessary.
Okay, well, thank you, Daphne, again, for making a system that obviously has a lot of technical kind of makeup, and putting it into a format that all of us can understand and really appreciate everything that's going into creating this capability to provide the data and everything that the department needs to, measure its performance. So we appreciate that. Let's move on then. Are there any items of new business? We'll ask our committee members and Stuart, any items of new business that we would like to bring forward this morning? Okay, hearing none, we will adjourn and we will see everyone, in about an hour. Thank you, everyone.
Thank you.
Thank you.
Thank you. All right.